Hi, everybody. This question comes from our monthly Ask Dr. David Live series. Hope you find it helpful. My question is about kids' sinus pressure, pain, and headaches associated with it, which is often the issue during winter months. Besides saline spray and humidifiers, are there any other remedies you can recommend? Okay, so first of all, important to understand that sinusitis, as with any itis, means inflammation of, not necessary infection of, that area. So inflammation of the sinuses. Okay. People are more prone to having sinus inflammation during the cold and flu season simply because there's more cold and flu that can cause inflammation. Bacterial sinusitis is really considered kind of a questionable iffy diagnosis. And, certainly if a person's been sick for 5 to 7 days with fever and the pressure that can happen, in younger children, they don't get the pressure above their eyes, and because those sinuses don't even develop until closer to 10 years. More often pressure is here or in these small ethmoid sinuses that are right to the side of the nose, or the maxillary sinuses, which are right here. And certainly if you were to tap on somebody and they're like, oh, that really hurts, then that's a sign of a sinus inflammation. But because we are dealing with inflammation, and of course, hopefully somebody would have started the immune support protocol or vitamin A and all the other things that we've talked about so many times before, that we've put onto our channel in the past and is now found in the useful info section of our patient portal, as well as on our Patreon page for people who want to be supporters of ours, want access to this information. But since this is about inflammation, we want to be reducing inflammation. Coming back to our gold standards of having good vitamin D and zinc levels, which keep inflammation as a more in check in the first place. But this is a place where, yes, nasal rinses, clearing the area out, getting things in circulation, that can be very good. Nasal steroids. Now, medications like Flonase over the counter can be very effective for reducing it. And these are medications that are specifically designed to not get into the bloodstream, to just stay in the on the lining of the respiratory tract, upper respiratory tract. So it doesn't have the same concern as doing an oral steroid, although an oral steroid certainly would help as well, but obviously we're more limited to that. That's the thing that's not over the counter, but it can be very effective. In a short course of even oral steroids, I think, is a pretty safe thing to do. Other things such as curcumin and high dose omega-3 fatty acids, again, can have more of that anti-inflammatory perspective. Blowing the nose as much as you can, especially if a kid can, keeping that airway all clear as well, that too can be very helpful. Okay. I would certainly not be opposed that if a kid had a cold and then a few days later maybe it was more of a sinus infection. If they'd been a few days off of the high dose vitamin A, I'd be very okay with repeating another 2 days to see where it goes. Typically speaking, though, if once a kid hits about the 10 days, if it's constant, nonstop, relentless runny nose, etc., then that is maybe where you do call it a sinus infection. And then are there sometimes proper to use an antibiotic? Absolutely. But at the same time, almost all of the times when people are told that they have a sinus infection, it's not necessarily a bacterial infection, and the antibiotics. In fact, I was even taught back, and this goes way back to my days in my in medical school. So this is like 91 to 94, and I remember that their ear, nose, and doctor told me that the running joke amongst ENTs is that if you put somebody on antibiotics for 3 weeks for a sinus infection, if you put somebody on antibiotics in 3 weeks, they'll get better. If you don't put them on antibiotics, in 21 days, they'll get better. So that was kind of like what our professors taught us when I was in medical school. And certainly more and more information has come out to say, is antibiotics just a placebo? Is it something that's really necessary for the long term? But nonetheless, that's, eventually someone does decide, oh, we need to do it. And how many times have I seen it? And, that somebody else put on an antibiotic and they were fine. And I'm like, yeah, well, we don't necessarily know, because you were just a few days into this, whether you would have gotten, or your child could have gotten better anyway. But nonetheless, those are kind of some of the remedies that I do use for that. And sometimes it can be helpful.